can talk about the community health improvement plan, I have to mention about the community health assessment. And this is of greater importance because the community health assessment is what drives the community health improvement plan. This is not the Portage County Health District's plan. We do not have ownership of this plan. We have many community partners that provided input into this plan, and it is an actual community plan. So even though I'm presenting this information, I do not have ownership of it. It is comprised of all of our community partners that provided input into this process, many of which are sitting in this room. The community health assessment was actually released in March of 2016. It actually commenced back in 2014. So it took 2 years to complete our community health assessment. It was the first community health assessment that was ever completed for Portage County. So we should all be patting ourselves on the back for getting that accomplishment. It's actually what the assessment is a comprehensive look at the health and well-being of the children, youths, and adults within our county. It is data. It is all collecting of data obtained by independent surveys. So we surveyed adults 19 and over, youth 12 to 18 years of age, and parents of children aged from 0 to 11. A lot of our schools participated, and a lot of the community actually received those surveys. Actually, Kent State University and the Hospital Council of Northwest Ohio were the primary two big agencies or partners that actually put our community health assessment and the survey tool together. They're the ones who looked at the design, the instrument development, the sampling, the procedures, all the things behind. We just didn't come up with a survey and say, let's just throw this out there. There was a lot of background and a lot of information, a lot of time that was put into the development of those surveys to make sure that they were appropriate and we were going to get back the data that we wanted. So the health assessment truly is a snapshot of our community based on those surveys that we provided. So that was done once that community health assessment was completed, then we have this massive amount of data that we needed to look at. That drives into the community health improvement plan. So from that assessment, we want to know how can we improve our community. And what we did was we released our community health assessment or community health improvement plan just this past August of 2016. So we had 4 meetings, and these were 4 actual 4-hour meetings, collaborative sessions. Like I said, many of the people in this room were part of that process, and it was very good participation. We had actually, on average, about 70 participants in each of those 4-hour meetings, and we had approximately 40 different agencies that were represented during each of those meetings. So we had a great consensus to build upon, to look at that assessment and turn it into an improvement plan. I mention this because everything was done by consensus. So it wasn't the health department or the hospital or mental health or any one particular, the sheriff's office, the coroner's office, any one of the mayor's office. It wasn't one particular agency. It was all of us working together as community partners, looking at the data and driving down from that data to try and identify what are the biggest priorities facing Portage County. And what are those, out of those priorities, what can we do to make an impact over a 3-year period? How are we going to impact those? We don't want to say, you know what, we're going to cure poverty for Portage County, because that's going to be something that's unrealistic for us. We're able to work toward that, but we're not going to be able to make significant accomplishments within the next 3 years. So what we chose to do was look at 5 priorities, and this was through much deliberation to get to these 5 priorities based on that health assessment that was conducted over a 2-year period. The 5 priorities that were identified by consensus by those multiple agencies, over 40 agencies, were to increase injury prevention, and you see them on the screen, increase mental health services, decrease obesity, increase access to care, and decrease substance abuse. Those were the 5 priorities, and that's really the big takeaway message. So for the next 3 years, we have multiple agencies throughout this county that are actually working on these 5 priorities, trying to make an impact over the next 3 years. The one that I wanted to highlight, obviously relevant for today, is decreasing substance abuse. And what I've done is I've highlighted the objectives, because every priority has a list of objectives tied to that priority. And as you can see up here, you can see that there are people's names after each of those objectives. We identified the objectives that we needed to accomplish for each priority, and we also identified a person that was going to be responsible to report out on a quarterly basis progress. So every quarter we are reporting out progress for these specific objectives. And we've already started that. Starting in September, our first round of progress is going to be collected in January 2017. So the first one, develop and implement a community-based comprehensive plan to reduce alcohol and drug abuse. Notice that we're not just saying drug abuse, we're saying we want to take both sides of it, alcohol and drug abuse. The next one, increase treatment options for those with a substance use disorder. Implement and increase prevention programs. And these are going to be throughout Portage County. These are not tied to one specific geographic area. Implement and increase harm reduction initiatives. Carry on, these are, again, some more objectives for the decreased substance abuse priority. Increase the number of healthcare providers screening for drugs and alcohol. And as you can see, even though there's one person responsible, it's going to take a variety of community partners to try and accomplish these objectives. It is by no way tied to, just because that person, I give credit to that person to step up and say, you know what, I'll be responsible for this objective. Because they have the big job of talking to other community partners and other people that were involved in this process and people that were not involved in this process to get results. We're trying to make an impact. We're trying to get results on a quarterly basis and within a 3-year period to make a difference. Advocate for substance abuse and criminal justice issues. And the next one is implement a tobacco and smoke-free policy on Kent State University campuses, which they've already started. They actually started this in the late spring, I believe, correct?
It'll be in effect July of next year.
July of next year will be in effect. So really what I wanted to, and this was my big 15 minutes here, what I wanted to mention and the point that I wanted to drive home is the actual significance of this community health improvement plan. It's the first time that our community has had a community health assessment and a community health improvement plan. The CHIP, everybody calls it a CHIP. The CHIP, the Community Health Improvement Plan, was created, as I mentioned, by community partners. It's not something that I sat in my office and said, oh, these are great things for us to try and achieve over the next 3 years. Or talk to a couple people and said, what's top on your list? This was actually done through a very methodical process and over a period of almost 3 years to actually get this together. I also want to mention that, like I said before, it's a 3-year community plan. We've identified 5 priorities, and we've already started working with these subcommittees for each of. I have established subcommittees for each of the priorities, and we started in September of 2016. Okay, so what I wanted to show you was this is our website, the Portage County Health District website. So even if you Google co.portage.oh.us/PCHD, but if you Google Portage County Health District, it'll come up. What I wanted to show you on our website, just briefly, is If you scroll down, these are our flu clinics, by the way. That's not what I wanted to show you. But our flu clinics are all posted on there. And what I wanted to show you was at the bottom of the first, at the home page, you'll find both the Portage, the health assessment, 2016 health assessment, as well as the improvement plan. And when you click on either one of these, like I'll click on the health improvement plan, and the whole plan actually comes up. So the whole community health improvement plan is 100 pages. Is that the most, what this is it details out the whole process on what we did to put this together. The community health assessment plan is longer, 200 pages, I believe, somewhere around there, right? Yeah. But what I wanted to point out was that when you go on to either one of these, the assessment's different, obviously, because it's looking at has all the graphs and all the data that was compiled. But this one will actually go through, and you'll be able to see. I'm trying to get to the templates. So you'll be able to get to these templates, and those are really what the important things are. Because you'll see that, like this one's decrease obesity, and you'll see the actual, what the priority is, what the objective is, and some of the bullet points for year 1, year 2, and year 3. It's all spelled out. So that's the significance of why I wanted to show this to you. You don't have to read through the 100 pages to learn what we did for the whole process. This is really an important part. And if you'd like to get involved in that or want to be part of that or any of these, please let us know. Finally, I want to mention that in all of your packets, there's a Project Dawn information sheet. So that is in your packets as well. And one important thing that I have not heard today that I did not want to fail to mention is the fact that I believe as of November of 2016, I think it's almost within the span of 1 year, and I believe the sheriff was the first one to step up to say all of our officers will carry naloxone. By the end of November, all of our law enforcement within Portage County will be carrying naloxone. So, and I got to give a lot of credit to Rebecca Lehman and Karen Hall, certainly, because they spend a lot of times in community meetings and forums throughout our community on weekends, in the evenings, to promote and make sure that we are supporting our processes so that law enforcement can carry and our community members can also have Project Dawn kits. So with that, I'll conclude. Thank you very much.